Hello friends, I'm Shaurya Mishra. Welcome back to your own YouTube channel, Vision Care Advisor. Friends, today's topic is Aicardi Syndrome. Let's know what is Aicardi Syndrome. Aicardi Syndrome is a rare genetic condition when babies are born with three main problems in which the brain is not developed fully and can cause various abnormalities. It is characterized by the partial or complete absence of structure in the brain that is called corpus callosum, which connects the two hemispheres of the brain. Additionally, individuals with Aicardi syndrome may have retinal lacunae. Retinal lacunae is a lesion in the eye or multiple bilateral depigmented chorioretinal lacunae and experience epileptic seizures, particularly in the form of infantile spasm. Chorioretinal lacunae are clustered around an undeveloped optic disc, often accompanied by coloboma, a gap in the structure of the eye, or cataracts. The inheritance pattern is X-linked dominant, meaning it primarily affects females and is usually fatal for males before birth. Affected girls typically do not survive beyond the first few years of life. Other brain and skeletal malformations may also occur, along with intellectual disabilities, which can range from severe to moderate. Let's know the causes of Aicardi syndrome. The exact causes is unknown, but it's thought to be due to a mutation in the gene that hasn't identified yet. It's considered an X-linked dominant disorder, which means it usually occurs in individuals with two X chromosomes, typically females, and it's often lethal in male before birth. Let's know how to diagnose Aicardi syndrome. Diagnosis is mainly based on the symptoms and physical examination findings. The classic triad of infantile spasms, partial or complete absence of the corpus callosum, and chorioretinal lacunae are key indicators. Brain MRI scans and eye examination can help to confirm the diagnosis. Genetic testing may be done, but there's no specific test for Aicardi syndrome since the gene hasn't been identified. Friends, let's know the risk factor of Aicardi syndrome. Since it's a genetic disorder, the main risk factor would be having the genetic mutation that causes the syndrome. However, no specific risk factors are known because the genetics of Aicardi syndrome are not fully understood. Let's know the sign of Aicardi syndrome. The sign includes the classic triad mentioned above, along with other brain abnormalities seen on the MRI, such as cyst around the third ventricle or choroid plexus, and abnormalities in the optic nerve or disc. Let's know the symptoms of Aicardi syndrome. Symptoms typically begin in infancy and include seizures, developmental delays, and it could be possible that vision problem maybe occurs. There may also be issues with muscle tone, spine and rib abnormalities, and gastrointestinal problems. Treatment of Aicardi syndrome. So friends, treatment is symptomatic and supportive. Seizures are managed with anti-epileptic drugs or devices like a vagus nerve stimulator. Therapies such as physical, occupational, and speech therapy are important for development support. Patients with Aicardi syndrome often require care from various specialists, including neurology, gastroenterology, and dermatology. Let's know the prognosis. The impact on vision varies, but there can be severe visual impairment, especially if the macula, the center part of the retina, is affected. Life expectancy is variable, with some individuals living into adulthood, but the syndrome can lead to life-threatening complications such as difficulty to control seizures and problems related to severe neurological impairment. I hope this short video would be helpful for you. Thanks for watching. Stay tuned for more informative videos.